Hi, my name is Ken Cutbush. I'm an orthopaedic surgeon working in Brisbane. I'm a shoulder surgeon. I'd like to talk to you today about the use of benzoyl peroxide in preparation for your operation. Shoulders are different to other joints in terms of the possible infections that you get with them. What we typically see with shoulders is non-suppurative infections. That means they're infections with bacteria that don't cause pus. So the typical bacteria that causes pus is the golden staph, and that's more common in joints such as hips and knees. In the shoulder, what we see, the most common organism is an organism called Cutibacterium acnes. It used to be called Propionibacterium acnes. It's now called Cutibacterium acnes. It's an organism that lives on our skin. It actually lives in the pores, in our hair follicles, and it comes out onto the skin. So when we prep in theatre with chlorhexidine, that will clear the skin of all bacteria, including Cutibacterium acnes. The problem is the Cutibacterium acnes lives down in the hair follicles and the pores of the skin. So after a while, maybe 20 minutes or half an hour, it comes out on top of the skin and can then get into the wound at the time of your surgery. What has been shown quite clearly is that using a preparation such as benzoyl peroxide clears the skin of that Cutibacterium acnes. It clears most of the Cutibacterium out of the hair follicles. And so that's very helpful in preparing for shoulder surgery. It's not so important for hips or knees because they're really typically not affected by Cutibacterium acnes. It's a bacteria that affects the shoulder more than any other joint. And so that's why it's important in shoulder surgery and not for hips and knees. So what it is, it's acne cream, and you get it from the chemist shop. We recommend benzoyl peroxide, 5% cream or gel. And we like you to use it for 5 applications before the operation. So that is twice a day, starting 2 days before the operation, and then of the morning of the operation as well. So that's 5 applications in total. And the area you need to apply it to is the shoulder area. It's actually particularly the top of the shoulder rather than the axilla. But we do ask you to put it into your armpit as well. So you get some on your hand and you apply it to the top of the shoulder and also into the axilla, and then you wash it off. You should wash it off within 20 minutes. If you're finding you're getting a reaction, if you've got sensitive skin, wash it off after 10 minutes. And you do that morning and night for 2 days before the operation and the morning of the operation as well. It's been shown to reduce the incidence of Cutibacterium acnes in the skin and in surgical preparations in the time of the surgery dramatically, quite a significant reduction in that the occurrence of the Cutibacterium acnes. And so it follows that it dramatically reduces the risk of infection with that bacteria. So if you're having surgery with me, my staff will recommend that you get this. That's for any operation that we do. It's particularly important for an operation where there's prosthesis going in, and certainly for a joint replacement procedure. I would very much like you to use this skin preparation before the surgery. Thank you.